The outline for my presentation is here. Essentially, I'm going to reflect on the Mayo Clinic as an institution and how social media fits with the history of the institution. What are the underlying values that inspire us in pursuing this? And then what are the concrete steps that we're taking to move this forward? The experience of the individual in social networks depends on the position of the individual on that network. And it's a notion of, moving from the Homo sapiens to the networked man. It should be the networked person. And the notion that as a network, we are more than we are as individuals. And that really explains the way we behave as societies. And this is work that Christakis and Fowler have taken up, and I think many of you are familiar with. So the experience of the individual depends on the position of that individual on the network. It depends on the structure of the network, how close the network is knit, and what flows through that network. For people to participate in the network, they have to appreciate that there is value to them. We heard that in the previous panel. And they have to, that value has to be positive for them to stay in the network and to further the network. So therefore, what flows through the network must be good for those who become part of that network. Otherwise, they will separate and form other networks. And the good, for good to flow, requires the network. So if you're interested in having a good disseminate or reach in other individuals, you have to put that good in a network. And then it will flow to the right folks. But you cannot do that if you are not a member of that network, if you're not contributing to that network with generosity. So each node of the network contributes to it, and those most connected contribute the most, and the trick here is will benefit the most. And to me, this science, the science behind networks, articulates for those who want an evidence-based approach as to why should I join, articulates the reason why individuals involved in healthcare, from patients to organizations, have to be in the network if they want to benefit from healthcare and if they want to offer goods in healthcare. The Mayo Clinic started in Rochester, Minnesota. This is a very small town, and it was destroyed by a tornado. And Sister Mary Alfred looked at the situation and said, we need physicians, we need hospitals here to take care of people. We don't have this opportunity in this town. And contacted Dr. William Worrell Mayo and said, Doctor, if I build a hospital, would you staff it? Would you staff the hospital if we build it? Now, Dr. Mayo made the wrong calculation. He assumed that these nuns will never be able to raise the money to make a hospital. And he said, sure, I'll do it. And then the nuns turned around, and within a record time, these are Franciscan nuns, within a record time, fundraised for the hospital and built the hospital. So then Dr. Mayo had to staff the hospital. Two of his children went on to become physicians, and when they came back to the Mayo Clinic, they became the Mayo brothers who grew the Mayo Clinic to what it is today. Now, if you look at the position of Rochester, Minnesota, it's in the middle of the United States, towards the north, towards the border with Canada. It's a very, very small town. Right now, this is 100 years later, it only has 100,000 people. Out of the 100,000 people, 3,000 are physicians, 50,000 work for the Mayo Clinic. And it's a small town when the most distinguishing feature is the Corn Tower. I just brought my kids to see the Eiffel Tower, and the only other tower they've seen is the Corn Tower. It's a small town. But one of the things they did very early on is they did these incredible surgeries. And to let other people know about these incredible surgeries, they went around the world. And they were able to talk to individual surgeons and tell them about the surgeries and demonstrate the surgeries. Many did not believe that these brothers could be doing the surgeries they said they were doing in the middle of nowhere. So what they did is they invite them to come over. And they hosted many physicians that came to visit and to learn about their operation. When you start looking at the history of the Mayo Clinic, you realize that this idea of going out and telling others and having others come and experience it and then they go off and tell others, the notion of word of mouth has been essential for an organization in the middle of nowhere to become one of the most recognized organizations in healthcare. And there is quite a bit of evidence that indeed this word of mouth brings patients and clinicians and people that want training in healthcare to the Mayo Clinic. It was true then, it is true now. One of the other things that's very interesting to remember is that in its initial origins, physicians at the Mayo Clinic never charged another physician for care. That used to be part of the way physicians treated each other. Unfortunately now, something that's gone. They also did not charge the clergy. So think about it. If you're in a small town and you want to access the network of that small town, in that time, one of the major nodes, one of the most connected people in that network was the priest, the local priest. So having the local priest have a great healthcare experience and then being able to go back, one of the things that Mayo was doing is accessing and expanding its network, its social network, long before we had the technologies that we heard earlier on today. I'm going to illustrate the point of accessing the network and spreading good by a specific case example. So this is Dr. Richard Berger. He's a hand surgeon. He was able to discover a relatively rare cause of wrist pain, and it's called a UT split tear, and was able to come up with a surgery to correct that problem. A very famous baseball player in the United States suffered a direct hit with a baseball in the wrist that led to this significant pain, and he was essentially going to have to stop his career short. Dr. Berger had a chance to take care of him, do the surgery, and he was able to not only improve from his pain, but then went on to become a member of the Philadelphia Phillies, who then won the World Series. This story was commented heavily on Twitter, and as a result of that dissemination through now modern forms of social media, a patient who was having the same kind of pain recognized the situation and decided to go to Mayo Clinic for care. And she said that one of the things that was surprising to the Mayo Clinic staff when she was asked who referred you was her answer: Twitter. And this is what you had to say. Less than 24 hours after my initial appointment, I had a new diagnosis and I had surgery. I now have an annoying green cast. The short-term hassle, however, should be more than worth the long-term gain. And then she went on to say, a future that without Twitter and those in the medical community willing to experiment with new communication tools might not exist for me. She was able to meet this player at a game, and they were able to compare scars. But he also went on to gain tremendous notoriety after this and made an enormously incredible contract, but typical for these professional American players, showing that he was completely rehabilitated and recovered his value as an athlete after this. And this keeps on giving. And so Dr. Berger wrote to my colleague Lee Ace, who is a director for the Center for Social Media, and was pointing out that from a scientific standpoint, his ability to show these surgeries to other surgeons, the ability to spread the word, in his mind had actually shortened the usual time it takes for discoveries to make it to practice from 17 years to 2 years. This and other stories of an early effort by Mayo Clinic staff to be present in modern social networks led the institution to think we probably should invest a bit more in this and be more actively engaged, and with the creation of the Center for Social Media. And the goals of the center were to scale up the existing social networks that we have at Mayo, both the virtual plus the old-fashioned traditional networks that exist, to deal with the challenges that the modern forms of social networking, the social media offers in terms of both speed and reach. which far exceeds the traditional social networks, and then to make sure that one of the goods that flows through that network are the values of professionalism and the Mayo culture, that which holds that the patient's best interest is the only interest to be considered. And very importantly was that this was not a public relations activity where the clinic was trying to extend itself out, but it was a two-way street in which we not only speak but we listen, and in which the content is indeed co-created by patients and clinicians. One of the challenges in this space is that there is a very poor signal-to-noise ratio. There is a lot of noise and there is very little signal. And for folks, it is always a challenge to identify what is the signal in the midst of a noise. The Mayo Clinic Center for Social Media wanted to contribute to only one part of this equation, to the part that provides signal to patients and clinicians. Within the Mayo Clinic, we've been trying to do that through a number of interventions that are also open to folks outside of the Mayo Clinic, like our blog offerings, Facebook, Twitter, all these other things that you're familiar with. But I don't want to focus on these technologies. I want to focus on the nature of the signal that these technologies and future technologies will have to spread and convey to anyone in the network. We felt that it was important that we look inside the Mayo Clinic for stories that convey our values, and that we do it authentically. That the goal here is not present ourselves in the best possible light, but present ourselves as we are. As our patients experience us, as clinicians, and as clinicians experience the opportunity to be present at those important moments in the lives of patients. We felt, and we continue to feel, it was important to set knowledge free. That what we know at Mayo needs to be known by the world. We felt it was important to give voice to patients. If our primary value at Mayo Clinic is that the patient's best interest is the only interest to be considered, we need to know and be constantly reminded what is in the patient's best interest, and the only voice that can testify on that best interest is the patient's voice. And if the channels are overwhelmed by commercial messages and other kinds of messages, the voice of the patient will be very difficult to tease out from the rest of the noise. And the other thing that we thought we had to do is to learn. Because we are all, despite the examples we've heard, we are all relative newbies in the notion of using such powerful tools of social media to further social networking in healthcare. And to do that, we thought it would be better to do it together with other organizations. So as we moved into this space, we also had to recognize a significant amount of humility so that with being humble, we approached the space to learn. So the Mayo Clinic Center for Social Media was assembled, went from one full-time person to 9 full-time people. We have 7 folks in Minnesota in our original campus, 1 person in Florida, 1 person in Arizona. Those are 2 additional campuses that we have in the United States. Their job is to maintain the content that is being produced, to engage Mayo Clinic staff, so more folks within Mayo, if they want to, if they feel it's consistent with their job and their needs, participate in the effort. We offer additional internal consulting to groups within Mayo Clinic who want to make greater use of the resources for social networking. And also we provide social media training internally as well as externally. This is an example of the kind of training that we provide, for instance, highlighting challenges that have been discussed before of people behaving badly, not because they're in social media, but because they behave badly. And I think someone mentioned the fundamental rule being that you would do in social media like you would do in real life. And that needs to be, people need to be reminded of that. the example we were discussing before about business models, and the notion that physicians can have conversations in a protected environment was highlighted. But at the same time, we heard that these conversations were being sort of recorded in some way for later harvesting and then offering them to potential sponsors. And again, if the rule is that you behave in social media like you behave in real life, this will be like putting recorders in my living room as I invite my friends to a party, and then selling the content of those recordings to someone that may be interested in selling something to my guests. Since I wouldn't do that in my party, I wouldn't do it in a social media system. To learn, we set up a social media health network. And this network is, again, to learn, to share experience together with other hospitals, with other organizations, with patient groups who would want to find out how best to engage in this space and to learn from each other about mistakes that we all make and things that we do right. Again, because what you put in the network is what gets spread, and if you put something good, people will want to be connected. It was important to do this from a values perspective. And so we engage in this network with generosity, with integrity, and with patient-centeredness. To do that, we embrace an open access model. We embrace a support for a series of common tools that all of folks in the network can have access to and use. And the idea is that anyone whose genuine interest is to promote health, to fight disease, and improve healthcare can participate. We set a goal of 50 members by year 1. Unfortunately for our staff, this has been much more successful than we thought. We are not yet at the 1-year mark, and we have 74 members from 4 different continents. Clearly, we have not been as good as engaging folks outside the United States, but we expect that that will change perhaps after this meeting. So what do members get from participating in the network? They get resources to speed their institution's adoption of social media. They get curriculum, they get training, they get help with some policies, guidelines, job descriptions for folks that may need to be hired to do this work internally. They get support for technical services. They also get to participate in conferences, webinars, member meetings, and essentially it created a community of communities that allows folks to learn from each other. It's a network about networks. Let me finish by pointing out that what we think is the next step for organizations, for healthcare organizations like the Mayo Clinic, is to continue to engage, cultivate, and grow the social networks that we already have. Regardless of the technology, the ones that we belong to, the ones in our communities. But then to expand those, to include those that can be expanded through social media. I think it is important to be explicit about our values and purpose. Are we for patients or are we for profit? Are we authentic or are we in the space to spin the information so that we look great? I think we need to listen. I think we need to try. We need to make mistakes. We need to learn. We need to share those lessons learned with each other. And we need to do it together, with each other, all the organizations, but also with our patients. So I invite you to network with us. That's the hashtag for the Mayo Center for Social Media. That's the website. Lee Ace is the director of this center. You can Google him and find the curriculum that is live and available on the web. There's his email if you are interested in more information, and that's his Twitter handle. I want to announce a couple of events coming up. The summit for network members. It includes a meeting and an unconference. It's in Rochester, Minnesota, in that small town with that beautiful corn tower that I'm sure you want to take pictures of your family with. It's October 17 to 19 of this year. There will be other events, and I hope that you'll go to our website to look at those events. Thank you very much for your attention.